New at 9, we know our first responders see it all. Crimes, fires, and all kinds of accidents and emergencies.
And they also get called to help people who are suffering in a mental health crisis. A new study looks at how our first responders now say they have more resources to guide them when they're called to help patients who are dealing with mental health situations. Our Elliot Polikoff is live in the newsroom tonight with more on what the report found. Elliot?
Vanessa and Jared, this report, called the Spark Report, includes responses from hundreds of first responders and mental health experts across Arizona. The feeling is there's been a lot of progress, especially within the last decade, regarding mental health resources available for the patients they are called to care for. But there's also still plenty of work to be done.
In the past, it was really bad.
And Surprise Fire Medical Deputy Chief Jesus Rivera isn't referring to that long ago, just within the last decade.
Everybody would go to an emergency room, and so they would go there. Many times they wouldn't receive the care they needed because the emergency room doesn't provide mental health care. So then they would sign out against medical advice, call 911, and they'd want to go to another facility.
Rivera says Surprise Fire started their Treat and Refer training services for first responders in 2015, where Surprise Fire can directly transport patients to behavioral health facilities to get them the help they need. The report says the city of Phoenix has transferred some people who have called 911 to the 988 suicide hotline number launched last year, and in some cases, to city mobile crisis teams.
It's getting them sort of connected to the least restrictive service that they need and helping them to get better and stable.
Phoenix Police Crisis Intervention Team Coordinator Sabrina says Phoenix's usage of mental health resources has been a model for other cities across the country. But Taylor says despite progress, there's still a stigma associated with mental illness, and that impacts the resources available for first responders.
We're always fighting the systemic problems that we have of, healthcare coverage, healthcare access.
Taylor and Rivera both say the next step for Arizona first responders is making that transition to behavioral health treatment even quicker and more efficient.
We're already doing it at every stage of the criminal justice process, but I think we can always keep refining it and make it faster and increase the numbers.
Ensure that we all have the ability to provide people that are in a mental health crisis with the appropriate resources at the right time.
Both Taylor and Rivera say that some people that have received these mental health resources from Valley first responders have told them that they've been satisfied with the treatment that they've gotten. Live in the newsroom, Elliot Polikoff, Arizona's Family. Elliot, thank you. Phoenix police are hoping someone will recognize this car, which they believe is connected